Welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Herodopoulos. Now that the kids are back in school, they may share more than laughs. They may share head lice. I thought it would be a good time to do an overview on recognition and treatment of lice. Today we have Susan Hammerling, PA for Florida Dermatology, who sees and diagnoses a lot of cases of head lice. Welcome, Susan.
Thank you, Dr. Stephanie.
So head lice are parasites that like to feed on the scalps of humans.
Correct.
And unfortunately, we see a lot of that in our practices. And it is common, and it doesn't mean that you have poor hygiene, and it doesn't mean that you have you're not taking care of yourself. It just happens. But let's talk about how do we diagnose it, because we have a lot of differential diagnosis that
Correct.
People don't understand what it is. So let's talk about how do you diagnose it.
Well, lots of times patients come in, they have an itchy scalp. Some people do not have an itchy scalp, and they think it's dandruff. So the parents bring in the patient, their little ones, and say, oh, they have scalp psoriasis or seborrheic dermatitis, and I put them in an exam chair, and we have the surgery lights, and lo and behold, I find little eggs, which is not in dandruff and psoriasis. So lots of times they're sharing combs and sharing hats, and they have no idea, so they're passing it on to their children.
So they're like 2 to 3 millimeters in size, and they usually like to hang out around the behind the ears and the back of the scalp. So parents should routinely check their children for lice. And so the difference between dandruff and these eggs are?
Well, lots of times the flakes with dandruff, they come off your hair if you just flick them off, but the actual nits are almost cemented on to the hair strand. So, I mean, you can't just flick it off. And
so these lice lay about 6 to 10 eggs per day, and their lifespan's about a month from my research. So they could be there for a long time without the patient knowing. So it's good to be vigilant and check this regularly. So you diagnose it, now we must treat it.
Yes.
So there's over-the-counter meds, and then there's prescription meds. But you brought a couple of over-the-counter meds.
Rid, this is pretty inexpensive. It's like $22. Pick this up at CVS, and it's self-explanatory. One thing that you have to be careful with is if you have an allergy to ragweed or chrysanthemums.
And you can use this down to 6 months.
Yes.
And this one, Nix, is down to 2 months
yes.
of age.
So I know this is obvious, but a lot of people don't read the directions, but this just basically is self-explanatory on how to comb the nits out of your hair. They have metal or plastic combs, and they're enclosed in this, and they talk about the different hair lengths, short, medium, and long. So
you have to put it in the hair, you leave it on for 10 minutes, you rinse it out, and then the important part is also getting the nits out, because it doesn't kill the eggs, the nits, it just kills the lice, so you have to retreat it in 1 week.
Yes.
So any myths you want to talk about?
Well, I had one patient when I was in a rural area in Central Florida that they thought gasoline or kerosene would cure it, so I do not recommend that. We don't want to be treating burn patients in addition to the lice.
No kerosene or gasoline in the hair, but you can use dish detergent, which will unglue the cemented eggs to help comb out the stuff, right?
That's safe.
That is safe. Okay, good.
Shaving the head, some people, they just want to just shave everything right away, and you don't want to do that.
Well,
especially if it's a female patient.
Yeah, female. Maybe
that'd
kids,
be a little bit
boys,
traumatic.
See you later. I'll shave it, start over. No, but I agree with you. Now, we mentioned it's not because you're dirty before, so we want to make sure that gets out there. But also, these lice do not jump. It has to be head-to-head contact or contact with the surface that has lice on it, and you can't get it from your animals or give it to your animals, right? So I just wanted to make those couple points. But thank you very much for being on the show.
Thank you very much.
This was a fun segment that we did. For more information on this topic and other health news, check out Your Health with Dr. Stephanie, which runs every Thursday in the health news section of Florida Today, or visit www.floridatoday.com.